and we all, I'm a Southerner just like you. You heard that football joke. I'll get, don't worry, I'm a regulator, I can get back at him. Seriously, I am serious. I really want to thank all of you. This has been an incredible last 2 days for me. You have been warm and embracing, and you have been my true Southern brethren and sister, that last one is word, because you've been open and candid with me. And I've been living for the past 5 years in DC, but there's not a lot of openness and candor. You might think that with the headlines, but trust me, if you want somebody to tell you the truth, as they said, if you need a friend, you need to get a dog, because people will not tell you the truth in DC. But when I cross a certain line or two, I know I am with the people that I enjoy the most, my Southern friends right here. It's good to be home, so thank you very much. So Ms. Perkins, as most of you know, is to the point. And she said something about doing something the sunflower way. I really can connect with that. Because you know, Southerners, we know we want to, our fingerprints and our footprints on it. If not, it's not the right way. Do I have a witness out there? So I'm hearing from, Wayne, and didn't get a chance to say hello to you, Mr. Billy. But I got a chance to talk a little bit with Mrs. Ford and Ms. Collins, who told me about your initiatives and what all of this means to them, how it's changing their lives over the past few months, how living with this illness that is robbing my own mother of some of her greatest gifts, to be honest. She's a long-term diabetic. I see hope. I see hope at managing the disease that knows. My mother was 89 pounds when she got married. Last time I saw her, she was 115. It's not just about weight. It's not just about diet. We ate balance. Sometimes it's just about. And so she's struggling with this disease. I watch her every day, doing what you know you have to do, checking this, making sure her shoes aren't too tight. All of the basics that you and I don't even think of, some of you don't even think about, judging by the tightness of my shoes. But that is necessary for her. And it drives home to me why this is so important. For me as a regulator, one of 5 sitting in Washington, D.C., that I make sure that the policies that we pass, the things that we deliver to you, are in a form that will allow you to serve your communities. I will never, ever, ever forget the people who raised me in the South. I will never, ever forget that every time there's a decision before me, I'm going to ask how this will impact you in the South. And I promise to you that the connectivity that you need to enable all of these phenomenal opportunities, that I will be your advocate pushing, that everyone, regardless of income, regardless of literacy level, regardless of comfort level, will be able to find themselves, to be able to help themselves, to be able to uplift themselves through these modern platforms. I commit to you that I will never forget about who's important. The digging up the ground and the infrastructure, that's important, but it's people first. That's important. And we need to think about this thing, as it was said, beyond health, beyond just health care. We've got to think about wellness, sustainability, and all of the things, the positives that it will bring. Because if our children and those we care about, if they see the hope in us, if they see the opportunity in us, if they see that we can provide them the tools that will enable them to pick themselves, not only in healthcare, but that's important, but in education, civic engagement, and everything else in terms of opportunities that are important to us, then we have done our job. Am I right? So like you, I'm as an option. We will keep doing, we will keep trying, we will do every pilot we can afford to do, every pilot that even some of our people don't want us to do. We're going to get this right. We're going to have a blueprint, an opportunity, a template, a framework, and a song. For us to do what we do best. I'm going to leave you with a quote before the governor comes up. Earl Nightingale, and I mentioned this quote yesterday, and I'll just do one part of the quote, because I think this is reflective of what we know what's in store for us and what we know the possibilities of this is. Don't let the fear of the time it will take to accomplish something stand in the way of you doing it. We're not going to do that, right? We're going to look fear in the face and say, we've got too much to do to be stagnated by you. Thank you so very much.
It is great to be in Sunflower County. Now, you know, I love coming up here. My fondest memories as a child was Moorhead, Mississippi, Sunflower County, Indianola, where we used to go Christmas shopping because it was the biggest town we could get to. But as a small boy in the Delta, whose dad was a mechanic and worked on farming equipment, and whose mom stayed home and helped on the farm, it was not always easy. Now, healthcare was always a challenge. Dr. Phillips was our doctor. Dr. Phillips delivered me in 1954, December the 9th, right up here in Moorhead, Mississippi. And about the early 1960s, he built a clinic on the bayou. If any of you go by there, that building is still there, that blonde brick building. And we were so connected to Dr. Phillips's clinic. Later in life, when my two brothers decided it would be fun for all of us to throw firecrackers into the wind, and one went off near my eye, it was Dr. Phillips's clinic that I went to that Christmas day to have the paper removed from my eye. Somehow he knew how to freeze my eye and scrape that off and then give me an eye patch, which I thought was the coolest thing in the world. I went back home as a pirate that day. Dr. Phillips had done something miraculous, more than likely had saved the vision in my right eye. Rural physician, doctor, that came out on Christmas Day. He got up at 2:30 in the morning when my mother and dad were at Slaughter and came to Moorhead, Mississippi to deliver a little boy that would be governor one day. So here we are, back in Sunflower County. Now, Commissioner, I want to thank you. To have the Commissioner, the FCC here in Sunflower County is amazing to me. If nothing else happened but this gentle lady coming to this county and seeing what we are doing, I should be satisfied. I should say we have achieved our goal. Because she could be in any state, in anywhere in the United States. And they would be so proud to have Commissioner Clyburn there. She is in Sunflower County, and we should be eternally grateful for her. Commissioner, thank you. Now, as you've heard from Chrissy, Dr. Henderson has done an amazing job. If there is a Henry Ford or Thomas Edison of telemedicine in Mississippi, it's Chrissy Henderson. She has done a remarkable job from the first day we met. And so as I began to dream about access for those in the Mississippi Delta that was like my family, I'm not sure how we paid Dr. Phillips. I was talking to a friend the other day, and he said, well, I can tell you how you paid him. It was $2 for a visit and $3 for a shot of penicillin. And that was it. And that cured everything. Pretty well, that was the way it was. And so we had some access to health care, but as I dreamed of the families that were there, like mine, looking for that access, we thought about telemedicine. And I was in Paris, France at the air show, and I went into the chalet for GE Air, and there was David Joyce, and David Joyce stood up and said, there's the governor of Mississippi. You know, we make jet engines in 2 different locations in Mississippi, in Ellisville and Batesville, and their workforce is the best that we have. Those men and women in Mississippi know how to make things. I was so proud. I tried to get him to go with me to the other chalet, but he said, no, that's our competition. I better not do that. But But I said, now, you guys have a medical division. I knew they did, of course. And he said, oh, yes, it's a huge medical division representative here from GE today. And I said, we need your help. We need GE to come to the Mississippi Delta. Unfortunately, I have one of the largest populations of diabetics in America. My mother died of diabetes, a long, protracted, terrible illness took her life. My father was diabetic, my older brother was diabetic. So, yeah, I've seen it up close and personal. It is a horrible disease that ravishes those that have it. Now, we can say, oh, there's many different reasons for that. We understand that there's many things that you can do to help prevent it and take care of it, but to cure it, stop. So if we're going to dream of what we can do here in the Mississippi Delta, we've got to go big. We've got to be all the time for all we can do. So we thought about telemedicine, so we can get in everyone's home, and we can take 200 of the worst patients, the patients that are suffering the worst from the diabetes, and we can put them in this remarkable program and give them a device and help them track their own health care, make sure that we have the telemedicine necessary to the best doctors across the state of Mississippi, not only here in North Sunflower Medical Center, but University Medical Center, wherever we need to go to get those experts, those physicians that can say, here's what we need to do for you so that we can save, so that your quality of life will be so improved. And I tell people, even if you don't care about someone in the Mississippi Delta, you don't love them like I do, even if you think, well, that's somebody way up there in the Delta, I don't have to care about them, I'm somewhere else. Think of the money that we're going to save. The quality of life, not losing a limb, not suffering a stroke or heart attack, not renal failure anymore. Not all of that can come to an end. And we thought, how in the world would we ever do that? Who ever knew that broadband would be the answer? So we got old Cspire, they're from Mississippi too. So I called you and the guys and I said, we need your help. GE is in, University Medical Center is in. I talked to Jimmy Keaton and I got Dr. Henderson. I got the best of the best. I was around picking players for this. So it's kind of like we used to do, guys, when you get out there, and pick your team after school, and you get lucky if you got the best players. I was back 1,000. I got the best players. I got Christy Henderson. I got GE Medical on our side. Cspire immediately said, we're in. We got a broadband connection. We're gonna make sure that we light it up. We're gonna be there. So many times we just thought if we could make this happen, and we had. So now again. About 90 days into it, I think we'll save lives. We just won't have something exciting to talk about. We just won't have a nice vision. Lives will be saved. I have a new grandbaby. I always have to tell you that. I've got photographs if you'd like to see them later. But there are people in Sunflower County who want to see their grandchildren grow. They want to be there at their graduations and at their weddings. And we want them to be there. We want to provide that for them. So here we are, leading telemedicine. You heard Dr. Henderson say it's absolutely true. Only 7 states received an A rating for their telemedicine in the United States, and Mississippi is one of them. So the narrative that we're always the slowest and the most obese and the worst and this and that and the other just doesn't always fit what we're doing in the new Mississippi, in the new Sunflower County, in the new Delta. Because now we have to lead the way. And how wonderful would it be if what we're doing here could then be used in New Mexico, where they have a problem among their Native American population, and in Texas, and all across the world. See, this is just not about Sunflower County. This is about something global. Something that will go from this point, as I said earlier, this is where the stone hits the water, but the ripples will go around the world. And when one day when people say, how did this all get started? Where did this telemedicine begin that now has helped us find a cure for diabetes and manage this terrible disease? Somebody's going to say, Louisville. Where? Sunflower County. Where? Mississippi. Oh, no, that didn't happen. Yes, it did. Yes, it did. So here we are at the edge of greatness. not because of what I've done or the team that we've assembled, because of what all of us believe can be done. We believe we can do great things. We believe those people deserve the quality of life that we can help provide to them. So I want to thank all of you, Billy, all of you here at North Sunflower. It does my heart good. Now, I will say, when they say, well, exactly where in the Delta do you want to get started? I did pick Sunflower County. I'm going to go ahead and get that out first. You're right. I'm biased. This is where I wanted to begin. This is my home county. This is where I was born. This is where I know that the best of my times in my life were spent here as a young boy in Moorhead, Sunflower County. But you know what I've discovered? This is even better. What I'm able to do now as governor, to come back to Sunflower County and work with you on this great experiment is better than any memory I've ever had. You know, I like to ask people, what's the best thing that ever happened in Mississippi? I know you think of football. But really, you know, what's the most important, dynamic thing that has ever happened in Mississippi? Here's the answer. It hasn't happened yet. The reason it doesn't immediately come to our mind is because it hasn't happened yet. This may be it. Thank y'all for having me. God bless you.